Hey everybody, and welcome to Tales from the Clinic. This is a new podcast hosted by Dr. Molly O'Banion and myself, Ashley, just a regular gal. The premise of this podcast is all things pets and veterinary medicine. Dr. Molly is here to do that part. I am here to make sure she's using words us regular people can understand. Each episode we will dive into different aspects of veterinary medicine, interesting cases seen at the clinic, and just general advice on pet ownership in hopes of educating and giving a glimpse into our world. So, let's get started. Hey. Hey everybody, welcome back to the podcast. Today we are going to talk about the basic, more than likely, first surgery you will experience with your pet. God, I hope so. A spay or a neuter. So, spaying and neutering. We talk about it. We preach about it. We love it. We love spaying and neutering.
Mm-hmm.
Why? Because there's too many... What?
What?
Especially here in Texas, but I feel like it's kind of everywhere. There is a overpopulation crisis.
Crisis is a great word.
Rescues are at their brink, doing everything they can. Most shelters can't take anything else in.
We literally had a stray somewhat recently, like in the past couple of months, and we called the county shelter to ask them to come pick it up, and they told us to just let it go, that it had a better chance on the streets. That's so sad.
Yeah.
But it's just because of all these backyard breeders and all these people that aren't spaying and neutering, and it's just, we're overrun.
And then the stray population. I mean, it just takes... So I guess let's simplify it. There's one dude. There's 3 females.
Mm-hmm.
He gets all of them pregnant.
Mm-hmm.
They can each have 2 to 8 puppies. And then boom, that's 20. Let's say worst case scenario, there's 24 new dogs born.
Every 3 months.
In 3 months. And that's 3 dogs. And then once she gives birth, how quickly can she be re-impregnated?
Their parturition cycle is 61 days on average. So that's 2 months of being pregnant to giving birth. And then theoretically, she might not come into heat for another 4 to 6 months, but depends.
Yeah.
Sometimes they can be stimulated. So if they're around a male all the time, they can have heat cycles more frequently.
Yeah.
Cats can be super ovulatory. So they can be bred, have one horn, like one uterine horn. Okay, so cat and dog uteruses have 2 horns. People don't. People only have like the one uterine body.
Okay.
Cats and dogs have the uterine body, and then it branches out into 2 like branches.
Okay.
So cats can be super ovulatory, where they get bred and they have 1 litter and 1 branch, and then another male comes along and they're like, that's not enough, and they get bred again and they have another litter and another branch. That's a different age.
In the body at the same time.
Yes. So they'll give birth to the first litter, and then a couple weeks later they'll give birth to the second litter.
Cats are weird.
They're nasty. Literally, we spayed a cat last weekend that had a fetus that was probably 2 weeks away from being born, and then a tiny little bubble fetus on the other side that was just starting.
Oh my gosh.
Ho-hos, man. Nasty. And cats can choose when to ovulate. So if a male's around, they go, okay, done, ready. God. So they reproduce so fast. It's cat infestations can happen in the blink of an eye.
Yeah. So, spaying and neutering. Best way you can, protect your own pet, which we'll go into as well, but also to help out with this crisis that Houston, Houston, all of it's experiencing. But I'm pretty sure
we're not the only ones.
Yeah, there's a ton of states I've heard of.
Everywhere.
Yeah.
It's not as bad up north. And this sounds really bad, but I think it's because the winters are so harsh, like the stray populations dwindle down. And then the summer comes and they repopulate some, but then the winter comes back and then they...
Cuts back the numbers.
Right.
Yeah.
But down here, the free-for-all.
Yeah.
South America, Central America, free-for-all.
Yeah.
It's horrible.
So, with that in mind, let's jump into it. So, spaying and neutering. You usually say either 6 months or a minimum of 5 pounds.
It depends on the breed.
Depends on the breed.
So cats, it doesn't really matter. 5 pounds is kind of like my ideal anesthesia weight. Like anything less than 5 pounds, the anesthesia hits them a little bit harder. It's a little bit harder to monitor their cardiovascular systems.
Okay.
So, but that's like my personal preference. I have some like shelter organizations because I work spay and neuter events sometimes. They'll spay kittens at like 6 weeks old.
Yeah.
Like babies.
Yeah.
And they do fine. But for me, if I'm giving recommendations to a client, I want it to be as safe as possible. 5 pounds. For dogs, it more depends on the breed.
Oh, that's right. Larger dogs, you wait longer.
So there's been a lot of studies recently because everybody is so obsessed with finding the perfect spay and neuter age. So they're studying how it affects the body long term and what side effects it has, right? Yeah. So in goats, for example, if you castrate a male goat before like 4 to 6 months old, they're more likely to have urinary blockage later on because their urethral opening isn't as developed, which is crazy.
Yeah.
Now, dogs and cats don't work the same way as that, but that's a good example that popped into my head. For dogs, they've been looking into mammary cancers for females.
Mm-hmm.
They've been looking into bone cancers, and they've been looking into a lot of stuff. This is just the ones that kind of pop into my head.
Yeah.
And then they've been looking into more like genetic complications.
Okay.
And all of the studies are showing different results.
Oh.
Which is really frustrating.
Yeah.
So I guess it depends on what your priority is. You are less likely to have a hip dysplasia dog, which that happens in your large breed shepherds, Rottweilers, like those big guys.
Yeah.
You're less likely to have hip dysplasia issues if you wait until at least 18 months to spay or neuter.
Okay. That's a long time.
But every heat cycle that female goes through, they are exponentially more likely to have mammary cancer later on in life.
Yeah. Also PIOS.
Also PIOS.
Infected uterus.
Yep. Every time it goes through a heat cycle, a PIO is a risk.
Yeah.
So which is better? Do you want the possibility of a PIO or a mammary tumor, or do you want to try to avoid hip dysplasia?
Yeah.
You pick.
That's not fun.
Nope. The smaller breed dogs, we don't have as much problems. The smaller breed dogs, I'm like, they don't really get the hip dysplasia. They don't really get the bone cancers as much. I'm like, mammary tumors are bad, ugly. PIOs are bad, ugly. Spay and neuter early.
Yeah.
Like 6 months on little boys, 6 months on little girls, as long as they're 5 pounds, just give them done.
Yeah.
There's no reason to put them through all that crap.
Yeah.
The bigger dogs is where most of the discussion is.
Yeah.
Because they're the ones that have those problems that are conflicting.
Yeah.
Osteosarcoma is a really common bone cancer that we see in labs, Rottweilers, Dobermans, German Shepherds. And they are finding that there is a direct correlation with the age of spay and neuter. If they don't have hormones for at least 12 to 18 months, they're more likely to develop the osteosarcoma at late stage, like late life.
Okay.
But again, do we keep them intact for longer to hopefully avoid bone cancer, which realistically I see one bone cancer case every 4 months.
Yeah.
And risk pyometras, mammary tumors, accidental pregnancies, ovarian cysts.
Yeah.
Same thing goes for the males. Do I wait and neuter my German Shepherd puppy until he's 18 months old because I'm worried about osteosarcomas, which is the bone cancer?
Mm-hmm.
Or do I get him done younger so that he's less likely to have prostatic issues, less likely to have all the behavioral malfunctions, less likely to have flighting responses or runaway responses trying to find a female?
Yeah.
Less likely to pee in my house because he's not marking his territory?
Yeah. Interesting.
You pick. So having this discussion with clients is always hard because I am personally of the mindset of overpopulation is so sad, and I see the side effects of that every day, and it's horrible, and just spay neuter your pet. If a problem comes on later on, we will handle it.
Yeah.
But a lot of people want to make their pet the safest as they possibly can for the longest they possibly can.
Yeah.
But what does that mean?
Yeah.
So a lot of vets are recommending 12 to 18 months for the larger breeds and 6 to 12 months for the smaller breeds.
Yeah.
In an 18-month life, a female could have had 3 heat cycles already and been, what was the numbers are stupid. It's like your 99% chance to not have mammary tumor if you spay before the first heat cycle. Your 92% chance after the first I'm pulling these out of my butt, but I'm pretty sure they're reasonably close. And then it's like your 80% chance not to have one after the second cycle, and you're like 60% chance after the third heat cycle. Like it falls fast.
Yeah.
And then after you have so many of them, you're more likely to have it than not. And mammary tumors can be aggressive.
Yeah.
Like bone cancer.
Yeah.
So which one you want to battle? You want to battle the bone or the boob? Yeah, you tell me. I'll pick with you. You tell me.
Yeah. So I guess moving into the surgery aspect, anesthesia risk, it's always scary. Even I remember whenever I got ladybug spayed, like I was still nervous. I mean, even putting animals under for dentals, clients get nervous.
Yeah.
But the neuters aren't hilarious, but they're kind of hilarious because they're so fast.
I can neuter a cat in 1 minute.
Yeah.
Like flat.
Small dogs,
1 minute.
less than 5.
Yes. It's fantastic.
Spays obviously depends on size, but I feel like you do it in 30 minutes.
Oh, honey. New grads do it in 30 minutes.
Okay.
My cat spay, the girls at Kleinbrook were giving me hell this past week because my cat spay was like, I did 4 or 5 of them, and all 5 of them were like 6 minutes, and they were like, you can't get below 5 minutes, you suck. And I was like, guys,
Rude.
rude. And so then the last one, I was like, okay, I'm going to get 5 minutes. And so I really tried, and then I just kept tripping over and breaking my suture because I put pressure on myself.
Don't do that.
And so it was 7 minutes. Sad. Most dogs, unless they're pregnant or in heat or obscenely fat, most dogs I can do within 10 to 12.
Yeah.
Space.
Yeah.
Neuters are 5.
Yeah.
So really, the time they're under anesthesia is
not bad.
It's less than 30 minutes. It's quick.
Yeah.
And anesthesia used to be super, super scary, but we've got it pretty well figured out. Now, everywhere does have a couple instances every once in a while. I don't care where you go. If you go to a specialty hospital versus if you go to a shelter.
Yeah. They're
going to have pets that just don't pull through anesthesia well. It's going to happen. But it's rare.
Yeah.
I mean, we maybe have one every year or two.
Yeah.
And we put down 5+ things a day.
Yeah.
Most days between dentals and surgical procedures and like sedated ear washes and stuff.
Yeah.
Like it's rare. Now, if there's like an underlying health condition, that increases the risk.
Of course.
So like if I'm spaying a 10-year-old dog with heart disease versus if I'm spaying a 1-year-old young dog,
yeah,
that makes a difference. The 10-year-old dog is more likely to have an issue. If I'm spaying a pyometra who's sick because her uterus is a pus-filled balloon, that's an increased risk.
Yeah.
But that's what you get for waiting.
Yeah. Low cost spay neuter clinics.
Mm-hmm.
Some say there's pros and cons. I wouldn't ever because I mean they're doing something awesome. What they're out there trying to do, and it's making it available. Because with us, I mean, it can be a few $100s to get spayed or neutered, and they do it cheap. Now I know one quote unquote con is sometimes they have a 3-month waiting list.
Yeah,
because everyone wants to do it. But are there other risks with that quick
I don't
turnover?
Mind going through the whole inside what happens behind the closed door.
Yeah.
Because I work them, lately I've been working them every weekend.
Yeah.
So what happens is there will be one doctor and usually about 4 or 5 staff members in the building.
Okay.
And I don't always have my exact numbers, but usually it's 30 to 40 pets.
Okay.
Some of them are feral cats and stray dogs, and some of them are like private client owned.
Mm-hmm.
What I do is I go through, and anybody who's not showing super aggressive behavior in the morning, I go and listen to heart. If the heart's normal and the dog looks reasonably healthy or the cat looks reasonably healthy, then I approve them for surgery. If there's something that's worrisome, like out of the norm, that makes me question anesthesia at all, then they say, we're not the right organization for you.
Okay.
And they say, go to a normal vet for this that has more monitoring capabilities.
Okay.
So they do that right.
Okay.
They are, this sounds bad, but it's almost like an assembly line. Like they're just going down the rows and anesthesia, 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 anesthesia. And they're just filling my tables. And I have 2 tables that I'm standing in between. And I spay this kid. and I change my gloves, and I turn around, and I spay the next kid. And I change my gloves, I turn around, and I spay the next kid. And I'm just standing in between those surgical tables all day long, flipping back and forth, spay, neuter, spay, neuter, spay, neuter. And I'm doing 30 to 40 pets in a matter of 5 hours.
Yeah.
Then once I'm done with them, they wake up on these like floor mats that are right next to my tables so I can watch over them. And they have little monitoring machines on them so that we can tell if someone stops breathing or something. Like they start beeping real loud.
Yeah.
But nobody's like sitting there watching them one-on-one.
Yeah.
So the likelihood of having a post-op reaction is higher than like at our clinic where our LVTs are sitting there waiting to extubate them.
Yeah.
Until they're like ready, you know?
Yeah.
So, and then once they're up and they're extubated, they go back into their kennel, which is in a closed room that I can't see.
Yeah.
So they could look at their incision. They could have a cardiovascular event, and I wouldn't know.
Yeah.
The staff is supposed to go back there and check on them every 10 or 15 minutes. But you also have to realize they're dealing with 40 other pets.
Right.
So it's not as hands-on. It's not as one-on-one. There's not as much attention to each individual. But it's a high volume. So the goal is decrease cost as much as possible and do as many in a day.
Right.
And that's the trade-off you get.
I've heard that the anesthesia itself isn't like, do they use just like a general anesthesia, a general drug, whereas veterinarians use more specific to the species or breed?
Yeah,
that's
they have a
safer. Cocktail. Okay.
They have a cocktail for cats and a cocktail for dogs, and everybody gets the same thing. That's why if there's anything with anything questionable, punt to normal veterinarian.
Got it.
Because when we are doing anesthesia, we are choosing drugs and dosages of drugs and how to give said drugs according to that pet and that pet's health condition.
Gotcha.
Like acepromazine is a great drug to calm things down. And it's a fantastic drug for like all of your high-strung puppies that are bouncing off the walls. It helps keep them calm before we put them under anesthesia, and it helps us be able to use less of the anesthesia drugs to put them to sleep.
Okay.
But if I give acepromazine to anything with a heart disease, it can worsen that heart disease, and then the anesthesia drug could kill them.
Okay.
And I actually don't know if they use acepromazine in all of them, but acepromazine is a really cheap option, and it wouldn't surprise me if they did.
Yeah.
So if something comes through my clinic that has heart disease, I'm not going to give them ACE.
Yeah.
If something goes through a low-cost clinic and they have heart disease that we just didn't hear, they might be getting ACE.
Yeah. It's kind of the risk. And I will say that, like, I think some cats can get neutered for like $80. That's amazing.
But you're also not doing blood work on them. You're not doing full preoperative exams. You're not doing EKGs to find things. You're not doing, and like we find stuff all the time that we didn't know about in our pre-op testing that would have been a problem.
Yeah.
You know?
Yeah.
So like it's a safety factor.
Yeah.
But safety costs money.
Yeah. Well, and it is like you said, like a lot of it's the trap and release type programs where
we're trying to get rid of the feral cat populations. So they're trapping feral cats, we're neutering them, and then we're putting them back out.
Yeah. Recovery time. I know the neuters are easier than spays because neuters, you're not cutting into the abdomen. Generally, we say give it 14 days of rest. If we were to get down into the details, I think neuters, you've said it could be technically 3 to 4 days, but why risk it? Just do the 14.
Neuters are so much less invasive. It's all external structures. The bleed risk is so much less. The main risk that I see with neuters is incision site infection, if they're like looking at it or scratching at it or whatever.
Yeah.
And scrotal hematomas, where if there's a bleed somewhere because the dog's acting stupid or whatever, the scrotum fills up with like a big old blood clot that turns into this big purple bruise, and then it oozes, and it's beautiful. But that's not life-threatening. It's just annoying.
Yeah.
And it takes more nursing care to come over that. Spays, we're going inside the abdomen. We're dealing with a sterile environment, internal structures, and there are large vessels that we're having to ligate. And you can die if they are not ligated correctly or if that ligature slips.
Yeah.
And if I do a spay on a crazy little puppy and it goes home and it starts running around like a fool, it can move those ligatures and it can start bleeding and it can bleed out internally.
Yeah.
life-threatening.
Yeah.
They also have an incision into their abdomen. So if I have a neuter dog that licks its incision, it gets an incision infection.
Yeah.
Okay, we give it antibiotics. It'll be fine. If I have a female dog that licks its incision, that incision can open up and its guts can fall out of it.
Yeah.
That's different.
A little bit.
That's very different. So the males, honestly, if they're probably going to act pretty normal the next day, and if you keep them calm for like 3 to 5 days, they're fine.
Yeah.
The females, if they're running around acting like a fool for that first 5 days and they rip something inside, you can have a life-threatening issue.
Yeah.
It's way more serious.
Yeah. Obviously, we send home pain medications. For the excitable dogs like mine, we did trazodone and ACE on top of it.
Yeah.
And she was just
Crazy.
a little zombie for 14 days.
Yeah, but you need them to stay still.
Yeah.
You can't have them parkouring
Yeah.
with their little abdominal wound. That's
Yeah.
not good.
Going up and down stairs, if we normally like to jump onto the couch, like literally nothing.
Yeah.
You don't want anything to stretch that abdomen out.
No. But then it's once and done. And then you're done,
Yeah. Then you're done.
supposedly.
Yeah. Hopefully.
Every once in a while we get an ovarian remnant.
Yeah. But
I've had like 2 in my career.
I was going to say.
Very,
Yeah.
very rare. Every once in a while you get a stump pyometra, which like the little bit of uterine left gets infected.
Yeah.
I actually have maybe only seen 1 or 2 of them.
Yeah.
Like it's few and far between. And if you get one of those, you're just real lucky. Go buy a lottery ticket.
Yeah.
Yeah. God, please. I mean, please. If you are an advocate for a certain breed and you're breeding to improve the breed quality, or if you are breeding as, I don't know, if you're a professional shower who works Westminster dogs or something like that, like, I understand. I'm not judging you as a human.
And you said before, those are important.
They are important. You have to keep a breed standard.
Yeah.
You need that. And there are people that breed to improve the breed.
Yeah.
So, like, we're trying to breed hip dysplasia out of German Shepherds. We're trying to breed heart disease out of King Charles Cavaliers, which I don't know that one's ever going to work. We're trying to breed bulldogs with bigger faces so they can breathe.
Yeah.
Period. And that is a good thing. But if you're just don't want to spend the money and you're letting your female dog just loose in the neighborhood and she's having a litter every year, stop.
Yeah.
You're dooming those puppies to get hit by cars and be emaciated and have mange, and that's just, is that a life worth living?
I don't think so.
So sad.
Yeah.
Blech. I'm judging those people.
Consider yourself judged.
Consider yourself judged. I'm going to look at you and I'm going to think to myself, I'm going to steal their dog and spay it and give it back.
There you go.
Which is illegal.
So that's a quick exploration of, pros and cons of spaying and neutering, what to expect.
We do it every day.
Every
it's
day.
Routine.
Yeah.
Like I said,
And it's
5
quick.
to 10 minutes.
Yeah.
Yes, you have a little bit of discomfort and you have to keep them quiet for a couple of days, but it's worth it.
Worth it.
Worth it.
Help us help the world of animals.
Oh, help us be heroes. We can't be heroes without you letting us be.
You should get that tattooed on your arm.
No!
So, but anyways, we will catch you later.
Make good incisions.
Thank you for joining us on Tales from the Clinic. Again, we are your hosts, Dr. Molly and regular Ashley. For more insider scoops into the vet med life and pet ownership, hit that subscribe button for updates on new episodes, and of course, share our channel to spread the word. Check the podcast notes below to see how you can get in contact with us. You can find all of Dr. Molly's affordable pet healthcare clinics on social media as well. Thanks again, and talk soon.